Dear friends, I am Dr. C.J. Keshavamurthy, geriatrician from Shumoga. Welcome to my geriatric medicine channel. You have been listening to my previous videos episodes also. Now, in this episode, I shall try to explain in a little bit detail about falls, FALLS, falls in elderly people. How frequently falls occur in the elderly people? Regardless of living arrangements, accidents are the sixth leading cause of death in the elderly, with falls being the most reported type of accident. Why fall should be considered as a serious accident? It's a question. Falls have a disastrous consequences in old age. They cause injury, fracture, and limit one's ability to lead an active, independent life. Thousands of older men and women are disabled, often permanently, due to falls that lead to fractures. Even the psychological fear of fall in the elderly people can be equally disabling. However, it is possible to prevent falls and injuries by undertaking simple changes in the surrounding environment and following safe practices. Friends, what are the reasons for falls in old age? Why do people fall down? Changes in the vision, that is due to cataract, or maybe due to retinal detachment or some other causes due to hypertension or diabetes. Then the hard of hearing, patient unable to hear the voices clearly. In reduced muscle strength, it is the commonest cause of fall. Then the coordination and poor reflexes make old people vulnerable to falls. In addition, diseases of the heart, the brain, the bones and joints, thyroid diseases, diabetes, thyroid disease, especially the hypothyroidism, and hyperthyroidism also sometimes, diabetes, all these diseases may affect the balance of the body and the gait of the person during walking. Multiple drugs taken for these diseases can also result in dizziness. Dizziness. Dizziness is different, vertigo is different. I have detailed it in my previous video episode. Blockouts. They can cause blockouts, and patient tries to support something but which is not there easily available, and the patient or the elderly person falls down. Most fall occur in bedroom and bathroom due to lack of proper lighting, slippery floors, books and papers on the floor, and minor obstacles in the environment. The two, while the patient is walking through the bedroom to toilet, if there are any obstacles like a simple stool or a chair or a flower pot, all these causes uh, falls in the elderly patient, especially the foot rugs or the floor rugs, which are floor carpets, let me tell you. If the corners are folded or rolled out, they may cause the patient to get obstructed, and patient suddenly falls down due to the same obstacles. Then, how to prevent falls and accidents in elderly people? That is very important. There are several simple steps which can reduce the likelihood of falls and accidents and make our home environment safe. Vision and hearing should be tested regularly and corrected as far as possible, and if defective, it should be corrected properly. A simple intervention like removal of earwax can improve the gait and balance of the patient. Correct spectacles have similar effect on the gait of the person, and so it prevents falls to some extent. Medicines may affect coordination or balance and cause falls, so doctor should be consulted regarding the side effects of the drugs always. Alcohol can affect balance and reflexes. Therefore, alcohol should be restricted, especially before driving. And patients with insomnia, many of us often prescribed uh, sedatives or tranquilizers, etc. They also cause dizziness in the body and make the patient fall down. So, one should be careful while getting up too quickly after eating, waking up from sleeping or lying down position, resting for long periods or resting for long periods. While getting up, what happens is the blood pressure may decline rapidly and cause dizziness or fall due to sudden change in the posture. That is called what we call the postural hypotension takes place, and the patient feels blackout, or dizziness or imbalance, and so they fall down. Use of a cane, walking stick, or a walker will help to maintain balance on uneven and unfamiliar ground or during a dizzy spell. But in my experience, our patients hesitate to take the support of a walking stick or a walker many times. They prefer to walk holding the walls and stooping forwards, and many times they fall down also. In spite of that, they won't take the support of a walking stick. Friends, in addition to these corrective measures, regular physical activity improves strength and muscle tone, which will help in moving about more easily by keeping the joints, tendons, and ligaments more flexible. Mild weight-bearing activities may even reduce the loss of bone due to osteoporosis. Osteoporosis is the decreased concentration of calcium in bones is called osteoporosis. If it is then the bones will become brittle and patient will fall down and sustain fractures. Fracture of usually of the radial and near the wrist, or maybe in the thigh and shoulders, etc. The fracture of the hip bone will often cause a lot of inconvenience to the patient and reduces his lifespan also many a time, and it is so better to use the canes, walking sticks, or walkers, or take the help of other family members while walking is very important. Dear friends, this is about the falls in the elderly people in our society, and its causes are mentioned here. So, go through this episode, share it, subscribe it, and uh, watch for the next videos or the episodes. Thank you. Jai Bharat, Jai Karnataka.